Well, welcome to today's Fireside Chat hosted by Override Health. I'm Stephanie Boyer, and I'm the VP of Growth here at Override Health. Override is a virtual interdisciplinary pain management clinic that actually brings together pain psychologists, pain physicians, physical therapists, and certified pain coaches to address the root causes of pain, not just the symptoms. Our approach is actually grounded in more than 30 years of research showing that chronic pain is not just a body problem, it's pain and the brain. And after 3 months, pain is no longer simply the result of an acute injury. It becomes a different condition altogether and requires a different kind of care. And so that's why we use a whole person brain-based model rooted in pain neuroscience. It's actually a more compassionate way of providing pain care. It's more effective and less costly than traditional pain care. So today we'll actually be focusing on one of the most powerful parts of our model, pain coaching, a tool that helps people retrain their nervous system, build resilience, and reclaim their daily lives every day. I'm excited to welcome some of our coaches here at Override Health, Kendi, Chris, and Paul. Kendi, why don't you go ahead and introduce yourself?
Sure. I'm Kendi Anderson, and I have been a pain coach since 2011, most recently with Override for the last couple of years. I live in Northern California, and I have been a homeschool or was a homeschooling mom for 30 years. That's kind of my fun fact about myself. But I
Wow.
actually was a pain client. That's how I came to even learn, like, I didn't even know there was such a thing as a pain coach. And after that experience, I took the training and became a pain coach and have continued to do that to today. So I love working with people and especially that niche of working with people in chronic pain.
Mm, yeah, it's funny how so many of us actually start our journey most likely as a chronic pain patient and end up serving others. Yeah. Chris, go ahead.
I'm Chris Sutton, and I am a pain coach here at Override. And I have a similar story to Kendi. I started as a pain client. I started working with a coach, and it helped me so much that I decided to become a coach as well. Before that, I was a professional speaker using comedy and humor to help people to laugh and feel better about dealing with change. I spoke to meetings and conventions all over the country and got to travel all around. It was a lot of fun, but it was also stressful, and that amped up my pain.
Mm,
I didn't know why. I didn't know what was going on, and doing all of this helped me to understand what was fueling my pain. And so I just absolutely love getting to work with people and helping them to break out of that negative feedback loop and move into a positive feedback loop and improve their quality of life, reduce their pain.
I love it. Yeah. Thank you. Paul, we'd love to hear from you.
Yeah, so I've been I've been working with people in pain since, well, officially since 2012. Um, but before that, I got kind of an early introduction. I was 17 years old when my mom, Becky Curtis, had a really catastrophic accident and developed chronic pain as a result. And after learning to get her own pain under control, um, founded what was called Take Courage Coaching, which is now, basically the same program of coaching as we see here at Override. And, in that time, I don't know, I got a chance to, see a family member that was really suffering with pain. And that was hard for me to be part of and to see. But it was also really inspiring to see her, get back to living life, get back to a more functional existence. And that really inspired me to do something with this. And so I started out by working at a multidisciplinary pain program back in 2012 as a fitness trainer, and then 2014 I took a coach training, and it just really changed the whole way that I worked with people, and I've been coaching people in pain ever since.
Thanks for sharing that. Yeah, I'm sure we'll dive deeper into that, but it's so interesting when we are in the ripples effect, right? It's like we've either experienced pain or we know someone that has experienced pain. It's profound. how many people are impacted. Now, for our audience, I'm curious if you can help us understand how pain coaching is different from general health or wellness coaching.
I think the thing we see the most is that most people that are in chronic pain aren't ready to change right away for a number of reasons. You know, they come out of a lot of challenges in the medical system where there aren't a lot of answers for their pain. And so a lot of times when we start with them, they're very discouraged about the potential for change or the potential to get better because they've tried so many things and it hasn't worked. And so something that that I see that's much different about pain coaching is we work with people who are a lot of times pre-contemplative about change or contemplative. They're not quite ready to take a step. And so I'm looking at two coaches here that are very patient. And Stephanie, I know you're a very patient person too. I think you have to be a very patient and empathetic person to be a pain coach because it's a slow process. It's not an instant results kind of thing.
I think we're also integrating, different kinds of information, I mean, whereas with general health and wellness coaching, it is looking at things like nutrition, and not to say we're not looking at nutrition, but not the forefront of what we're doing. We're not looking at, weight loss. It's not the forefront of what we're doing. We're looking at more things like neuroscience and getting back to life. So I think those are kind of the two main things are, pain education and how are we going to get back to life? So many people have been isolating and had a lot of fear. There's a lot of fear and a lot of anger for folks with chronic pain. And so how are we dealing with those emotions? And so looking at how to approach emotions as well. I think in a lot of general health and wellness coaching, those emotions are not quite as fired up as in pain coaching.
So you're saying the emotions really sort of ramp up that cycle in the brain. As a past allied health professional in direct patient care, I often said things like, I never met a frozen shoulder or a lower back pain that was just frozen shoulder or lower back pain. There's name any condition and there's an underlying component for that person that's not only a nice to address, it's actually necessary to get them to a place where it feels like they can have supported self-management, in this way. I'd love to hear from you, Kendi, too. How do you feel that pain coaching is different from general health or wellness coaching?
Well, I really liked what both Paul and Chris said. I guess the thing that was it keeps bubbling up for me is that aspect of hopelessness, right? So a lot of times with health and wellness coaching, which, like Chris said, we touch on a lot of those things, right? We talk about hydration, we talk about nutrition, we talk about movement, all of those things, right? But there's that piece of can't, right? And so coaching really, probably all three of us on this call have said this to our clients, and it was said to me as a client that you can hang on to my hope until you find your hope. And I think that's really a powerful piece of what makes our niche of coaching different than just health and wellness coaching.
Mm. Can you speak to why patients or clients that end up considering pain coaching as an option, why is there so much hopelessness?
Well, I'll take that one first. I think maybe one of the big reasons is they have just met a brick wall everywhere they've turned. And we've seen over and over and over, they've tried medical doctors and they've tried alternative doctors and they've tried chiropractic and they've tried whatever, fill in the blank. They've tried everything out there and sometimes have literally spent thousands of dollars and years, right, of trying to get there. So I think that's a big piece of it.
Yeah,
Also,
and then it makes you feel like a failure. It's been there, done that, got the t-shirt. I've tried it all. Eastern, Western, traditional, medical, um, alternative, and gosh, and it at first it's like, oh, they're failing me, and then it's like, oh, I'm failing myself, and now I'm failing my family. I'm failing everyone. I'm a failure. It starts to just become, I can't do anything. And also feeling like, oh, nobody understands me. Nobody understands me. And that's, I think, those of us who have had that own personal history or have had a family member, we all understand from that personal experience of what it's like to have people judge us. And we're not going to give that same judgment. We are there with that empathy of understanding what it's like to be trying your best and then going, you know what? I can't try anymore. I mean, I think we've all hit the wall, and at least for me, pain coaching it was kind of my last ditch hope. I think a lot of people come to pain coaching like, well, I've tried everything else. I'll give this a try, I guess. And, one of my early clients, he was like, it seems like a bunch of hocus pocus to me. But a month in, and this was somebody who had been in disability for 20 years. And then he did it. And after a month, he was like, I wish I had gotten this 15 years ago. It would have really changed the trajectory of my life because it's changing, getting you out of that loop. But when you're in it and someone says that to you, it just sounds like, oh, have you tried this? Like, I've tried it all.
Yeah, I feel that deeply.
Yeah.
Paul, do you have anything to add to that?
I love what Chris said because it paints a good picture of where people start out. I guess their world is really small. Right? There must be someone else that can do something for them or give them a medication or a gadget or an injection or a surgery or something that will change them. And the thing that, as coaches, we really believe that the client is capable of change, that they don't need to look outside of themselves so much for change. And that doesn't mean that there aren't some helpful things outside of them that can, sort of give them some stability in the meantime. I've had clients that have had surgeries that just changed their life because it created a stable body for them to work in. But the underlying belief of the coach is that this person is whole. They have the tools they need. They're just not aware of them yet. They're not aware of their strengths. They're not aware of their values. And so something that we're very gifted at developing in someone is their own self-belief. And we're not the ones that are actually creating the change, right? We're not the hero in the story. The client's the hero. And so we hand it to them and we say, I want to walk beside you while you become the hero on this journey. And it's going to be a fun adventure. We're going to see where this goes. So it's much different, it's much different than the way that people are treated in the traditional.
Also sounds different too, in that in a health and wellness position, our goal is to lift 20 pounds or run a race, right? We have a very distinct goal as opposed to pain coaching, where it sounds like it's more about the journey, right? Can you speak to that at all? How do you work with someone when obviously they come in wanting to be out of pain, but how do you balance that when you're saying things like they're already whole?
It's a really good question. I think you have to start where they are. And so it really starts just by seeing the good in them, and it doesn't mean that they are where they want to be yet, right? They probably have a lot of goals and things they would like to accomplish, but it means that you see their qualities, you catch them doing something right, because the normal way that we treat people is we see something wrong in them and we give them a diagnosis and say, this is wrong with you, and this is wrong with you, and this is wrong with you. And in coaching, it's much more about catching them in the right? Catching them in a state of resilience, and when you hear their story, helping them see how resilient they are to walk through all the things they've been through and to be at this place, or how how compassionate they are, that even though they're in suffering so much, that maybe they did an act of kindness for someone else. So it's really about helping them see what's good in them instead of seeing what's wrong in them. And that leads to renewed energy, renewed belief in their ability to set goals and accomplish things and go on this path of change.
I love that. Well, that's a good segue, actually. We've talked about the philosophy and sort of the overlaying view of how you all approach clients, but we'd love to dig into what are some of the tools or strategies that you teach most often that maybe surprise patients?
I'll jump in on this one. So I think one of the ones that tends to stand out for me over and over and over when I see patients kind of have a light bulb go on, because it's the one that happened with me, right? And that's pacing. I just got off of a call today and a gal was talking about she had just moved into her house. And so there's all these things to do, right? And she said, and I'm going to take it in small chunks, And so then we started talking about what that looks like, but just to have that mind shift, because she said something really important. She said, you know what? I'm finding I'm getting more done when I'm pacing than I would when I would hit my limit and be down for several days. So for me, one of those aha moments is figuring out how pacing works.
Pacing, I love that. And can you describe for everyone what is pacing?
Yeah, so pacing is really looking at whatever you need to do or want to do and breaking it down either into uh, timed sections where you're working a little bit and taking a break, or you're looking at the job and you're breaking it down from an activity standpoint. Like this woman today was saying, I need to clean all my walls. So I'm cleaning from the door to the outlet, right? And then I'm going to take a break. So that's kind of pacing, just kind of looking at what you need to do and breaking it down, because it all doesn't have to be done from start to finish when you start a task. It can be broken down.
I see. So it sounds like a very practical tool to help them not overdo, or maybe even in some instances underdo, right? Like we don't want to completely be immobile or stagnant, but finding a pace that works for that particular client. Okay.
Mhm.
Chris, how about you?
I've got two in mind. One is cognitive distortions. Um,
Can
you
you
know,
define that for us?
yes.
Help us.
Well, they're just ways that our thinking goes awry, ways that our thinking gets out of sorts, and that we can automatic negative thoughts, all or nothing thinking, having a automatic negative filter, catastrophizing. And so, having clients look at content that, rather than me telling them, but having them look at education around it, and then they kind of identify with it and go, oh gosh, I totally do that. Oh, I do this one, I do that one. And then talking about it and saying, well, having a conversation, exploring it, reflecting what I'm hearing, asking good open-ended questions and asking them, exploring how is that showing up for you? What might you do differently if that comes up? I think
Can I
that,
ask a question? Can you help make the connection between cognitive distortions, automatic negative thoughts, and pain?
yes.
Why is that even an issue for someone?
Well, those of us with a history of chronic pain are more likely to have these cognitive distortions. And so let's say, for example, I have chronic pain. And so I could then very easily go down this kind of negative thought spiral, rabbit hole. And it can start to cause a negative feedback loop that can then start to build my pain. So let's say I'm having pain, and then I'm like, oh God, I'm having pain. Uh-oh. When I get pain, then I'm never able, and notice I'm saying never, never's a sign that I'm in a cognitive distortion right there. I'm never able to do anything I ever want to do. Now I'm never going to be able to go out with my friends. All my friends are able to go hiking and I can never go, and it's not fair. And so notice now I'm really starting to go downhill, right? And all I did was I felt a little twinge. And so now I'm really starting to go down, 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 down. And I can start to ruminate. I can start to see everything through this kind of negative lens. And so then what that does is can start to make the pain start to feel worse because fear, if I were to create an equation, a mathematical equation for pain, it would be sensation plus anger, fear, resentment, repressed emotion equals pain. These emotions are the fuel for the fire of pain. And so when we can start to have this conversation around these cognitive distortions, it opens the door for this, and maybe the conversation was already there um, for how pain works from a neuroscience perspective. But then when we can start to have the conversation around the cognitive distortions, then we start to put it together. And it's like, wait, somebody put chocolate with my peanut butter? Somebody put peanut butter with my chocolate? Oh my gosh, I've got a Reese's peanut butter cup in my brain. So yeah.
I see. Okay. So if I were to repeat that back, it sounds like an example would be you're buying a car and it's a yellow bug. And now all of a sudden you only see yellow bugs on the highway everywhere, but in reverse.
Yep.
So now that you're having more of these negative thoughts, more rumination, you're going to see more of those yellow bugs. Your brain is primed for feeling more pain. Is that what you're saying?
Yes.
I see. Okay.
Definitely primed and
Okay.
going down that negative feedback loop. And
Okay.
so then when we can have conversations about, you're noticing these thoughts, what can you do when you're noticing these thoughts? This is where mindfulness comes in, and we can start using the mindfulness skills to start creating some change and then start to create a positive feedback loop. We start to change the thoughts, start to change then the emotions start to change, and then
Absolutely.
experience of pain can start to change.
I think one of the emotions that you didn't mention too, but that I felt a lot in my chronic pain journey was panic.
Yeah.
Right. So
Oh, yeah.
feeling panic and not know what to do, even from that twinge. And so you're helping a lot of people notice that in the moment to sort of stop those negative cycles
Yeah.
in that way. What about you, Paul?
I love that we're talking about interrupting cycles because I think that's really what the whole thing is. That's what tools are for. They're to interrupt a negative cycle that we're caught in. And I find that it's really, the nervous system is such a key part of that. And so I love introducing tools for people to calm their nervous system because it's sort of that gateway. When someone is stuck in what we call the cycle of pain, there's sensation of pain in the body, there's muscle tension, there's a hormonal release of cortisol, there's often lack of sleep that's associated with that. And it's this whole wheel that feeds off each other. And so what we want to do is feed and nourish our nervous system. And so I love introducing things like vagus nerve activation or deep breathing, or there's many different breathing exercises that can be done to calm the nervous system, and also being outside in nature. I mean, I'm a very that's something that's really near and dear to my heart. I've always been the kid that's out like chasing frogs and just interacting with nature. And so anytime I can get a client excited about playing in nature in some way, like it just has a beautiful way of calming their nervous system as well. So those are kind of that's usually the very first thing that I try to work with people on is just learning how to regulate the nervous system in a way that gives them a chance to calm their hormonal response, to sleep better, to feel more alive and more relaxed in their own body. And from there, everything starts to change from there, and it becomes more, they become more optimistic about what other changes they can make in their life once they've learned to regulate their nervous system.
I love it. Well, these are really great tools. So I guess my next question would be, how do you help patients stay motivated, especially when progress maybe starts to feel slow? I'm imagining, recovery or management isn't a straight, it's not a linear line. How do you help these folks feel motivated in this journey?
I think one of the things that, Paul mentioned real early on as listening for things, right? And the word that came to my mind when he was talking was we're always looking for strength, you know? So real early on in our relationship with our clients, we have worked at something called a vision statement, right? And then from there, we're really looking for things that continue to tap into that. So I'm kind of heading towards your question, right? So we are focusing on things that are truly important. Okay, so you mentioned earlier, a lot of times health coaching is I can lift this much weight, or I can run this fast, or whatever. I can compete in the Ironman, and we want to kind of take that competitiveness away from our clients and just really focus on, well, one of the things that I tell my clients is we're not human doings, we're human beings, right? So taking away that whole my worth is in what I accomplish. So for us in the pain coaching world, sometimes maybe to an outsider, those goals might look really small, but we're ecstatic for those small things, right? And even if it seems like it is slow progress, or maybe we're going backward, we're still looking for, what did you learn, right? So it's not a pass or a fail with these goals with pain clients. It's a, what did you learn about yourself? What did you learn about that goal? Maybe we need to rework that, right? Maybe that was too much, or maybe that was the wrong timing, or that was whatever, right? See, we're not looking for, you didn't do enough, right? But look what you did. And I'm guessing all three coaches on this call have said the same thing that I've said to my clients, right? Okay, so you set a goal of walking 3 times this week and you walked once. That's 100% more than you've been doing before, right? So we're really looking for pulling out those strengths and celebrating every win, no matter the size, because their value is in who they are instead of what they can accomplish.
Mm.
A lot of times when people think of goals, they think of, oh, it's more homework on my plate, right? It's like what I'm going to get sent home with after school to do in the afternoon or before bed. And like, I love what you said about vision, Kenny, that we first create the vision. And often we jump right into setting a goal before we set a vision, and it falls flat because it's not connected to our heart. It's not connected to what we actually know we need to do. It's not connected to our purpose. And so the first thing we do is connect to that purpose. And purpose is directly connected to a vision of our ideal, right? The life that we're meant to live, the role we're meant to have in the lives of our families, in the lives of people that we're around, in ultimately in humanity. What are we meant to do to make the world a better place? And so, something we do as coaches is really seek to understand what strengths does this person have, and then create an image in their mind of where are we going. Where are we going when you are at your best? And I'm looking at the 3 people here that have done that in their life. You all 3 know what that's like when you're able to take a vision and then take the action steps to make it reality. And so I think it's almost like we're planning this great adventure that we're going on. First, we're doing it in the form of an image that we're going to hold in our mind. And then, the steps are easy after that, because we know it's something that gets us excited. It's something that makes us feel alive. So the steps and the goals after that just naturally flow. They don't have to be a forced thing that's hard or difficult.
So it sounds like having a goal that's connected to a purpose is important. but also having a goal to would you say stay accountable? Like, does that help motivation in your lens, or what helps people be more motivated to follow that vision and goal?
I think everybody has different styles of that. I'll speak to mine, and I think Chris and Kenny probably have different styles than I do. I'm not a great accountability coach. I'm not someone who's going to say, oh, we agreed to do this and you didn't follow through with it, and I'm disappointed. Or obviously that's a very very exaggerated description of it, but I enjoy kind of rolling with wherever someone wants to go, right? So to them, one goal may be important one week, and their whole life circumstances change. They have a family member that becomes sick, or they get in a car accident, or they have a major pain flare, or something like that. And part of, I think, what has always worked for me as a coach is just to get into a flow with people to where, we navigate around all the challenges in life, and we still keep going in the direction of that ideal, that vision. Even when the life circumstances change, we have to take a detour or go around it or do something different. So that's sort of how I operate. But
I'm very similar. I go with the flow with wherever they are. I don't even say like, okay, what's your goal? I say more, what do you wanna focus on this week? Or what do you want to take away from the session? What do you want to remember from the session? And then from that, I'm like, okay, so how do you wanna how do you want to play with that this week? Or how do you wanna work with that this week? But I am not heavy on the goal word, on the G word, because
And frankly, it doesn't work, right? That's what I was
yeah,
trying to explore, right? How do we stay motivated
right,
while having those goals? And it sounds like you all are really, when you meet someone at their level, when there's a personalized way of meeting human to human, is that fair to say that that maybe helps motivate
right.
people in their journey?
Yeah, and exploring what their obstacles are as well. Um, and exploring why, their why. I mean, using the good old darn cat from motivational interviewing of like, what's your desire? What's your ability? What are your reasons? What are your needs? What's your commitment? Helping with activation. Um, just I mean, letting them lead the dance. I don't care if they do it or not. It's not it's not my life. I mean, I care. But it's not, it's no skin off my nose if they go to the pool or not. I'm not like sitting at home being like, "Oh my God, Paul didn't go to the pool." It's like that's up to Paul to go to the pool. Um, but if Paul didn't go to the pool, there's a reason. Let's explore that. And let's make sure, does Paul really want to go to the pool? Is that really, I mean, if Paul didn't go to the pool, maybe Paul doesn't really want to go to the pool. Maybe Paul's just saying that. But clearly, if he doesn't go, there's a reason. Let's explore what the obstacle is. And then let's explore, you know, what the reason is. And let's explore, was it unrealistic to think he was going to go 3 times a week? Let's celebrate the fact he went once. The more we're celebrating that one time, the more likely he's going to go twice.
I think what I hear you saying, Chris, is that when we simply take the time to uncover what's underneath the hood with these folks, that makes the difference. So there's flow. These are not static goals, and so it sounds like you're really taking the time to like, okay, that didn't land for you.
Right.
Let's see what else is going on for you, which obviously is not something that clients typically experience, right? Someone that's going to take the time to uncover all of these things that are feeding this pain cycle that you guys mentioned.
Well, and a big thing I find too is let's say movement. There's a lot of fear of movement. A lot of fear of movement. And, understandably so, because movement has typically created pain for a lot of folks. And so that can come with, say, physical therapy. And physical therapy is incredibly helpful for people with pain. And yet, so many of my clients are like, I don't want to do physical therapy. I've done it before, and it flares me up every time. I don't want to do it. And so what I have found can be really helpful is to help people learn about the science of pain, learn about the brain and the nervous system, get out of that fear cycle, get into moving the body, and help to bring down that fear, which then brings down pain, the pain fear connection. Then going to PT can be a different experience. Also working out with people on advocating for themselves to be like, you know what, and find the right PT too, that's not going to push them too hard and be like, no, drop it, give me 20. It's like you got having a PT, like our PTs are great. They're going to be tuned in. And so finding movement that feels safe in the body, giving yourself those messages when you're moving of, you know, that I'm safe to move in my body, so that we're bringing the fear down and we're bringing the confidence and changing the experience of being in your body, changing the experience of movement so that you can move in a way that feels good.
Absolutely. So the small wins stack up and create more motivation. I love it. Kendi, did you have
And
anything to add to that?
I do. And I was trying to sit here thinking, why are the three of us a little tiny bit uncomfortable with accountability, right? Because that's really not in our nature as a pain coach, right? But that's not to say that there's not some accountability, because I feel like there's maybe a less need for that accountability piece because of the time we're able to spend when they are saying, this is what I'd like to do this week. We're going into and why do you want to do that, right? And how does it connect to your vision? And what's the bigger picture here, and what's the drill down, right? So we've really gone into what is the motivation for them wanting to do that particular thing, right? Now, as the other two have mentioned, sometimes they come back and well, that seemed like a good idea, but that really wasn't where they really want to go, right? So we've kind of spent so much time on the front end and have all those things in places, because we talk about things like what's going to get in the way, right? What's going to be a roadblock for you? What's your week look like, right? So we've kind of moved all the barriers out of the way when we're doing the coaching with them, so that there's not that accountability to me, right? I mean, my goal, and I tell all my clients this, my goal is to work myself out of a job, because I want them to be self-coaching, right? I want them to be accountable to themselves.
I love that.
So it's still there. It's just, it's not our top rung on our ladder, right? Because we're doing so much front end work.
I see. Okay. Let's shift a little bit to a piece of advice. I oftentimes hear and see that people stumble upon pain coaching, like you all mentioned, 5, 10, 15, 20 years into their journey. Obviously we'd love to be considered as much farther up, in the stream there. But if there was one piece of advice that you could give to someone that is newly on in their journey with chronic pain, so someone that's had pain longer than 3 to 6 months, what would that be?
I think the thing that always just inspires me and gives me so much hope is that I see a lot of purpose come from pain. Not that pain is a great thing to have, right? It's a really hard road, but I'm looking at three people here that have their own pain story and have found purpose in that. And so everyone I work with, I do my best to see the purpose of their life and realize that they're not suffering in vain, that there is there is something beautiful that can be born out of something really dark. Every tree that we drive past was once a seed that was deep, deep in the ground, stuck in darkness. And I see our clients as that as well. So for anybody that's struggling with it right now, just know that there are people out there that care about you and see the good in you, and know that you can overcome and you can grow, you can change, you can improve.
Thanks for sharing that.
I think I would say a couple of things. Number one is I'm holding hope for you until you can pick it up yourself. And number two is everything that we do here is designed to help your nervous system, right? To get your body back into balance. So give it a try, right? Because nothing we do is going to be harmful to you. It's all designed to be gentle and the slow work that changes you over time.
Those were great. Those were great words of wisdom, both of you. I would just echo what you both say and say, don't wait. I wish I had had this earlier in my pain journey. I had chronic pain since I was a kid, and I wish that I had known about this earlier. And I wish that my doctors had known about it and had been able to tell me about this. And instead, I had to have a thought one night in the middle of the night. I wonder if there's such a thing as a pain coach, and Google it. So, um, your brain and your nervous system are what are driving chronic pain. And I know it seems weird, and that doesn't mean your pain isn't real. Your pain is 100% real. You're feeling pain, it is 100% real. And you have the power to change your pain, or at least to influence it, to reduce it, and to improve your quality of life. Because the way pain works, the neuroscientists have discovered so much. And what has been the typical pain treatment has been based on acute pain. And chronic pain treatment requires a different lens. And you are part of that treatment.
Absolutely. Let's just close with sort of a lightning round. If you were like one book or one podcast or one resource that you often recommend, I know that you've spoken about nervous system regulation and some different tools and already, but is there one resource that you always fall back on or send folks to in your journey as a coach?
Well, if I had to pick,
Oh, sorry, go
go ahead.
I'm always telling people to read The Way Out by Alan Gordon.
Yeah, the one podcast that I've recommended over and over and over for years is the Curable app, right? Their podcast. I absolutely love what they've done in their journey. I would mention a second one, the Pain Reprocessing Therapy podcast is also phenomenal. It's just, there's not too many episodes yet. Those are my top two.
A really great book I would recommend is The Pain Antidote by Mel Pohl. It's a really excellent book on just kind of shifting your mindset around pain and creating a paradigm shift within yourself that helps you change and really grow and heal from pain.
I love that. Well, I really appreciate your time today, taking time away from your clients to come together and have this important conversation, which I hope is the first of many fireside chats where we just get to dig into the very important and often overlooked work that you all are doing. So I really thank you for joining us today. I hope that this shines a light on pain coaching as a necessary part of the journey. And we're really proud of the pain coaching that we have at Override Health. So I welcome anyone to book an intro call or consult with us if they're curious about pain coaching in the future. Thanks all.